Good evening, everyone. I hope my voice is clear and I'm audible to everybody.
Ye- Yes, ma'am.
Yeah, okay.
Yes, ma'am.
So let's start off with today's topic. So today I'm going to discuss about hospital emergency plan principles and process. So previously, whatever we have discussed, so we have discussed about what is disaster, what is fire safety, and also we have discussed about how the hospital administrators play a key role in handling emergency situations. So let us today discuss about what is hospital emergency, first of all, and then how a plan to be done so that the emergency situation can be handled without any kind of difficulty or creating panic among the victims as well as among the staff. So let's start off with the topic, and before I dig into the topic, I want you all to give me a little background about what uh, idea do you have pertaining to hospital emergency. Anybody? Okay, so I'll start off the topic. So, moving on to the introduction, the purpose of disaster plan is to provide prompt and effective medical care to the maximum extent possible and thereby decrease mortality and morbidity that may result due to mass casualty incidents. So, when we talk about a disaster plan, so it is nothing but an emergency situation wherein people need medical assistance. So, when medical assistance is provided, then there will be stability in the health condition of that particular person or anyone who is in need of medical care. So the ultimate purpose of a disaster plan is only to prevent mortality and reduce the rate of morbidity whenever there is a mass casualty. So in this unit, an attempt has been made to explain the hospital emergency plan principles and processes. It's totally about how the hospital fraternity will handle an emergency situation. So, moving on to the next slide, which is about a disaster plan need and objectives. The main objective of hospital emergency plan is to prepare the staff and institutional resources optimally so that disaster situations can be managed effectively. So, if a plan is priorly done, or if there is a plan that is uh, done by a whole committee or people, hospital administrators, the management, the medical team sitting together and jotting down certain points that will help during the emergency situation, will help in handling the situation when it really happens. Okay, so this plan will help in preparing all the people who are in the organization so that the disaster situation can be managed effectively. The emergency plan should address external as well as internal disasters. So previously, if you remember, we have discussed about types of disaster, wherein we have discussed about natural disaster, man-made disaster, external and internal disasters. So any kind of disaster, the hospital fraternity should be ready with an emergency plan so that they don't worsen that situation, but they handle it smoothly and there are no mishappenings, or there is no loss of lives. Okay, the disaster plan goals when hospital are not affected include enhancing the capacity of admission and treatment, following triage, providing treatment and continuity of care to the existing patients, making availability of medicines, doctor consultation, medical equipment, materials, etc., required to handle such situation. So I'm just reading out these points because we'll discuss about these in detail in the coming slides. But before I discuss about all these points, I'll just give you a brief information about these points. Okay, so first one is enhancing the capacities of admission and treatment. So disasters don't tell and happen, they are sudden, and they are such a mishappening that happens in this society or in the community or any place, which disrupts the whole system. Okay, so whenever a disaster happens, so it is very much mandatory that medical assistance is provided to make people survive, and also to control the complications which people are going through. Following triage is nothing but segregating or categorizing patients according to the level of injury they have, or level of trauma they are going through. The next third one is providing treatment and continuity of care to the existing patient. So when a disaster happens, it is not like we completely concentrate on the victims who were affected because of the disaster. It is also people who are already there in the hospital getting treatment should be provided care, making availability of medicines, doctor consultation, medical equipment, materials, etc. required to handle such situation. So simultaneously two things will happen, that is controlling the situation wherein disaster victims are there, you are triaging them, giving them treatment, seeing to it that people are not landing up into any other complications, and at the in the other hand, you're also treating the patients who are already in the hospital or the organization, or and people who are like recovering from the illness and are ready for the discharge. So everything you will plan accordingly, but you cannot exclude any of the group. When a hospital is not affected by disaster, controlling large number of people and managing problems in an organized manner becomes the goal. So if there is no outbreak of a disaster, or if there is uh, uh, the situations are under control and there is nothing happening in the society, then normal protocols, means the usual protocols, usual norms are followed, and whatever the hospital policies are there, they happen regularly, they function as usual, means a regular functioning happens, and ultimatum is to treat the patient, provide him qualitative care, and make him get discharged from the hospital to lead a healthy and sustainable life. So but whenever a disaster happens, it can be due to any cause, it can be due to uh, the natural inhabitation or man-made or internal or external, but such situations need a proper and vigilant uh, uh, action. So first thing, when we discussed about disasters that happen in the hospital, first thing is preparedness measures should be put into effect. So as and when there is a disaster happening, first thing is preparing the medical fraternity to go and safeguard the victims. Second one is preparing staff to act in such situations. So as you all remember, again in the previous unit we have discussed about mock drill is nothing but you are creating a fake scenario and you are training your staff so that they get that confidence to deal in the real time situation whenever a disaster takes place. So preparing staff to act in such situations is nothing but whenever a disaster is happen, it is not a no one man battle or no one man initiative. So it is a teamwork that can help in uh, stabilizing people who are injured, and then taking help from outside hospitals or healthcare organization. So in case if there is uh, what you call earthquake or building collapse, so there will be many people, there will be many victims who are injured, who might be dead, who need emergency services, medical services. In that scenario, one organization will not be able to provide the healthcare deliveries whatever victims need. So it is very much important to have collaboration with the other hospitals or other healthcare organizations, so that if a particular hospital is not able to provide all the healthcare benefits to the patient or the victim whoever has come to the hospital, they can put a referral and send them to a better hospital wherever the amenities are very much better. Okay, and then is bringing back the previous situation as quickly as possible and restore the working condition. So a disaster happens, people, mass casualties start coming into the hospital. It is no it is very much important that you make decisions firmly, start triaging people, start moving people, whoever have minor injuries, by giving them first aid and sending them back home if they don't need very much medical assistance. Or if people are bleeding, injured, need sutures, put them into wards or the additional units, whatever we have put for controlling this disaster situation. And we start doing procedures whatever they need, and making them to go to particular wards where they can rest. It is not no the thing wherein the hospital should continuously focus 24 bar 7, focusing on only the victims of disaster. Simultaneously they'll have the other people who are already into hospital or who are in need of doctors walking into hospitals. So the work conditions should be managed in such a way that there is no injustice being done to people who are walking in and people who are already inside the hospital. So that was about the general introduction and what is the need and objectives of uh, hospital emergency. Next, moving on to principles of a hospital, or principles of a hospital emergency disaster plan. The hospital disaster plan should be predictable, simple, flexible, concise, comprehensive, adaptable, and anticipatory, and part of regional health plan. So, when we talk about plan is nothing but prior handedly we are assuming things, we are making assumptions, so that whenever a situation comes, we can implement the plan that we have had earlier. Okay, so whatever plan we have regarding an hospital disaster, it should be predictable, it should be simple, it should be flexible, it should be concise, it should be comprehensive, means easily understandable and easily adaptable, and anticipatory, means people should not know what do you call, uh, feel taking a back step, rather than they should give ideas and show initiation in participating whenever a real time situation comes, or else whenever there is a committee meeting, coming up with ideas to do it in a better way. Then generally the regional health plan includes the hospital emergency plan, should be predictable to manage, as we already discussed. The plan should be simple enough, flexible, and proper delegation of responsibilities. This is very much important, because if people don't have that caliber of controlling the situation or handling that situation, then uh, we will start losing the lives of people, or we'll start complicating the situation over there. So it is very much responsible that the committee makes a decision in providing proper means in delegating the duties to people who are expertise in it, and also seeing to it that everybody collab together and work, so that there is no rush and there is no uh, errors that happen. A comprehensive plan to provide inter-hospital transfer facility and maintain network for various healthcare facilities. So comprehensive plan is nothing but uh, triaging people first thing we'll do, and then after triaging, shifting them to the other units. If people need surgery, shifting them to operation theaters. If people had a surgery, no, shifting them from operation theaters to surgical units or post-op area. And also if there is there are certain procedures to be carried, then saying to it, we put a referral, or we completely transfer the patient from our hospital, wherever the patient is getting treatment, to other facilities. Then adaptable plan should be provided, wherein people don't escape but try to show initiative in saving lives of the victims. The plan should be anticipatory, planning for the worst scenarios. So anticipatory is nothing but, as I said, you having ideas, knowing about the situation, because we cannot predict how the situation will be when a disaster takes place. So people should also be capable of handling worst scenarios. The hospital disaster plan should never be in isolation and should be integrated with the regional plan. So every disaster plan that is discussed about or is planned should have connection and should have a proper objective, so that it doesn't fall apart whenever it is no, uh, what you call implemented in a real time situation. Next, moving on to process of developing emergency disaster plan for hospital. So again, we have discussed in the prior unit about phases of disaster, that is pre disaster phase, and post disaster phase. Now I'm going to give you a scenario. So I want you to tell me about what will be your approach and how you will categorize the duties, or what will be your three-phase plan. Okay, so I'll give you a scenario wherein um, an outbreak, sorry, a building collapse that happened, and there were 35 people uh, who were missing. Okay, and there were 75 people who were injured. Again, I'm repeating: building collapse, 35 people injured, sorry, 35 people missing, 75 people injured, and evacuation process is happening. So what will be the disaster phase, sorry, pre-disaster phase, post-disaster phase, and disaster phase? So can anybody give me an example?
Ma'am, do you mind repeating the question, please?
Okay, so I am giving you a scenario wherein you being a nurse, sorry, administrator, a hospital administrator. So what will be your pre-plan to control a disaster? That is, as I am giving you I am throwing you a question that there was a building collapse wherein 35 people were missing, 75 were injured, and evacuation process is happening. So what will be your pre disaster phase, and post disaster phase?
Okay. During the disaster phase, I would
So
prioritize.
I want, first thing, as we have discussed in the previous slides, we were talking about before a disaster happens, we have to come up with a plan, because then and there we
Yes, ma'am.
cannot make or take decisions, right? So, what will be
Yes,
the
ma'am.
pre-disaster plan?
Uh, okay. Ensure that. Okay. For example, if it's a flooding
Mm,
or maybe a fire incident, ma'am.
okay,
Uh, Ensure that all the fire safety protocols are being followed by
okay,
regularly checking, ensuring
okay,
that every person in the hospital staff knows how to operate
okay,
fire extinguisher and
okay,
etc.
okay,
And make sure that everybody is acquainted with the premises of the hospital so that they know where the exits are
okay,
if they have to evacuate.
yes,
And if I'm not wrong, ma'am, last class we've discussed that they have to be at least 12 mock drills done every year.
yes, annually, yes, correct.
Yes, yes. So ensure all of this is followed. This is for pre-disaster.
So I have given you a scenario wherein I said that there is a building collapse. So now, how will you act during the disaster phase?
Building collapse, ma'am.
Yeah, building collapse.
The hospital building.
No, any building. It can
Any
be
building. Okay, okay.
yeah, it
Okay,
can be
okay.
an
So,
apartment. But
okay,
what
okay.
will be your disaster phase plan?
Okay.
I'm trying.
So, ma'am,
I'm trying.
So immediately, how will you do triage? Because
yeah. So,
I have said
so
that
usually,
35 people are missing. Okay, 35 are missing, 75 are injured, and evacuation is happening. And you can give me any number, but you have to justify to my question.
ma'am, there's something called as bagging and tagging, if I'm not wrong.
That is when you get people, according to, again, I'm
Yes, ma'am.
telling,
The
like,
different tags.
yeah, different tags are given when you find that the whole building no is being emptied by all the victims who were affected in that building collapse, right? And also
Yes, ma'am.
that after the triage system you will do it, and bagging and tagging according to the level of injury or the trauma they are going through, and bagging will be done for people who are dead.
Yes, ma'am.
Mm.
Um, so 35 members are missing. 35 people are missing. In that
Yes.
scenario, um,
It's a very simple thing. Again, I'm giving you, because if you apply logic, you'll get the answer. First thing is,
Yes, ma'am.
as I said, 35 people are missing, right? 75
Yes,
are
ma'am.
injured. So for
Yes.
first thing is, for 75 injured, you will start, somebody said that triaging. Very good. So you will triage them and see to it that from the disaster area, you will shift them to medical fraternity to get the best care. Okay. And the
Yes.
evacuation process is happening, wherein you stabilize people and again send them to hospital. They are not allowed to stay in that area, because we don't know, there might be any internal injuries. And again, 35 members missing, that is the whole sole responsibility of the other departments that are with us. It can be fire department, it will be police department which is engaged, because they are all the disaster team, right? Not only the hospital fraternity, wherein they will take initiative in finding out the people who are missing, and they will no, refer that particular person to a medical fraternity professional, so that care can be provided. Okay. So thank you for answering, and whatever you have answered was very much clear and accurate, right? uh, so let's carry on with the session. So as I have given you the examples, please remember every example what I have given. So when we discuss about the process of developing emergency disaster plan, so this emergency disaster plan is universal, and it has been approved, and this plan has been approved by the government of India, wherein the disaster risk management program that is initiated all over by the government, and this initiative is very much important to be no, applied in every settings, every organization, not only in the hospital settings. Okay. And then this disaster risk management program will help in reducing vulnerabilities that are caused by disaster. And as per the hospital guidelines, the emergency preparedness planning will be done by the uh, hospital administrators, hospital management, and the no, chief members of the medical department. And accordingly, they will follow this three phases, that is nothing but pre-disaster plan, which already the committee will sit together and will finalize about how an emergency situation should be handled. And second one is disaster phase. In the disaster area, how you are going to take action, respond, rescue, and make sure that people are safe. And the third one is post disaster plan, that is after the pre disaster thing happens, disaster thing happens. So when in the disaster scenario, whatever is observed, all the committee people will sit together and discuss about what were the pros and cons that happened in the disaster area, whether the no the rescuing was done properly, the evacuation was done properly, the triaging was done properly, and elimination of risk was done properly, because the situation is no so panicky. People don't know what they are doing, though being from a medical profession. People know their only ultimatum is to evacuate people, send them out, and then see whatever is happening. At that particular point, they do mistakes by if a person is injured or has a fracture, they try pulling people, though their ultimatum is to rescue and evacuate them, but there is a chance of causing a major injury or a minor injury to the no victims. So whenever a post disaster phase happens, it's nothing but all the committee people sit together, and they'll make sure that whatever happened in the disaster scenario, how was the previous plan implemented, was it worth it, or do we need to do any changes, everything is discussed again over there, and modifications are done, and accordingly the mock drills and the staffs are trained after knowing whatever happened in that particular situation. I hope it was clear for you. So this is a very simple explanation that I can give you. And again, further, we have the same three phases. I'm not going to repeat for everything. Everything is same. First thing, again, I'm repeating, pre-disaster phases, whatever the hospital plans and how it prepares its staff in doing things or helping people who are affected during disaster. Second one is disaster phase, that is during the time of disaster, how you're going to rescue, evacuate people, triage them, categorize them, transport them. Everything comes in the disaster phase, and many departments will function together and rescue people. Third one is post disaster phase. After the disaster phase is finished, in the post disaster, all the committee people and people who are involved in helping the victims of disaster will sit together, and they'll jot down whatever happened in the scenario, what were the pros and cons of it, how it can be done better by preventing risks, and creating further policies or changing of the plan, doing some manipulations in the plan, in doing it better the next time. So this was about the process of developing emergency. I hope it was clear. If you have any doubts, you can ask. Okay.
It
So
was clear, ma'am.
yes. Okay. Thank you. So next, moving on to pre-disaster phase again. In this phase, most of the disaster planning is done, as it is important to plan for emergency before it strikes. This phase includes planning, preparation of disaster manual, and staff education and training. These plans are formulated and submitted for the suitable forum for approval. So it's not only planning, doing stuff, but also people should need an approval from higher authorities, discuss and get the ideas of expertise, so that they don't land up into any problem, or they don't you know lead, or they don't give a scope of causing errors. Okay, so let's discuss about the plan. So the plan includes so many components. So the first component is hospital disaster management committee. So hospital disaster management committee is nothing but all the hospital administrators and all the chiefs of medical department, chief of nursing services, the deputy nursing superintendent, and the additional assistant nursing superintendent, and few other senior nurses. They come together. They are the committee members, where and pharmacist, everybody will be there. So every member will sit together. they, this committee will plan about how to control a disaster and how to manage a disaster. Sorry, not how to control, it is about how to manage a disaster situation. Okay, and the most important task of this committee is to get approval from the disaster risk management department, that is through uh, the board of directors from the government, so that they can do everything in an manner, and also in the with the association of the other departments like police department, the fire engine department, and the other hospital settings. Okay, and then moving on to the second one is central command structure for incident command system. So this central command structure or incident command system is nothing but whenever a disaster takes place. In the previous session that I have discussed. So in the last class, we have discussed about fire safety, right? So in the fire safety, before alerting and activating the codes, we are supposed to inform it to the communication systems department, wherein they take a lead and they start alerting people everywhere. The same thing happens here, wherein the central command structure or incident command system plays a important role in controlling the situation, rather than causing more difficulty or worsening the situation. And second one is job cards. So job cards is nothing but giving proper authority or delegating the work to proper people who are expertise in it, and also and letting them know about the alarms, the activation, no, the codes that to be activated during the time of disaster. Next is plan activation of different areas of hospital. So whenever a disaster happens, it's very much important that you don't confine or restrict the area of providing treatment, because maybe the routines of the hospital are different, but whenever a disaster situation happens, the whole routine of the hospital is changed. You need to shift people from one ward to the other because you need space for the mass casualties that are walking in into the hospital. And then also you have to aware the lab laboratory staff. You have to you know also aware people who are in the OTs, who are in the surgical units, and you have to even aware the doctors about the disaster situation, so that all the units have manpower, good manpower to support the mass casualties. Second, and the fifth one is disaster beds. Disaster beds are nothing but providing extra beds. For example, the casualty has only 10 beds, wherein the mass casualties that are coming into the no emergency department are 30. So we need to start arranging for extra beds, or we need to empty a ward that is right beside the casualty and provide space for the victims that are walking in. And then next one is planning of public information and liaison. So planning for public information and liaison is nothing but, so one public health officer will be there who will pass the information to the uh, family members of victims, and to uh, the media. And also a liaison is nothing but a liaison between uh, you know uh, s- people, media people, as well as the logistics are nothing but need of equipment, more need of medication, or more need of assistance for supporting the victims or the mass casualties that are in hospital. Seventh one is planning for security of hospitals in emergency situations. So as a disaster happens, no, people start walking in into the hospital because of the mass casualties, and along with the victims there will be their relatives or family friends or family people. No So there will be a huge rush in the hospital whenever there is a disaster. So it is very much mandatory to alert all the security and to have additional security to control the emergency uh, situation. And then logistics planning, as I already said you during liaison, logistics are nothing but making sure that the equipments are ready, and no the pharmacy has the stock of medicines to support people who are coming in. And then the lab facilities are durable, or and the equipment that is needed for that particular situation, or to help people who are in that situation should be checked multiple times. And then planning for communication is nothing but, the disaster has happened and the whole society knows about it, then there is no point in hiding what is happening. So the hospital no fraternity should also be very much cautious in spreading the information or giving the information to media, and to aware the public about what is happening inside, rather than limiting it in that particular no walls. And then moving on to transportation. When we talk about transportation, transportation is nothing but from the area of disaster, picking up the victims, transporting them to emergency units. And if in the hospital wherever they are brought, the facilities are not no means the hospital fraternity is not able to meet the needs of that particular victims, putting a referral and sending them to better hospitals to give them proper care, qualitative care. And then stores planning is nothing but stock, maintaining the stock, so that we don't run out of no the amenities. And then personnel planning is nothing but, for example, generally to provide care to patients who are in the hospital, we are like we take like 2 to 3 nurses or 4 or 5 nurses are sufficient to handle a situation in a usual day. But when it comes to a disaster situation and mass casualties walking into hospital, then the personal planning is important, wherein where one nurse is serving people, we need three nurses, one doctor or two doctors, two nurses to support people in stabilizing their health situation. And then financial planning. So as I said you, before the disaster happens, we have a plan. So when we plan, during that time we should also be aware about the financial status of the hospital in investing or in budgeting about what are the equipments that are needed in supporting people during mass casualties. Okay. And then operations planning is nothing but when the casualties start coming to the hospital, then arranging for a reception and a triage area, where we'll start categorizing people or triaging people. And then decontamination area is nothing but already the people have come with multiple injuries, and they are in a position where their immune status is highly compromised. So putting them in such a safer and sterile zone so that they don't land up into complications or face so much trauma. And then acute care area is nothing but to treat minor injuries or minor uh, uh, health issues whatever they have. And then definitive care areas is like sending them to suturing whichever organ is damaged, or wherever they got laceration or high injury, means high level injury. Then we will try to you know do sorry, we will try to put sutures, or we'll try to stabilize that particular part, or immobilize that particular part, and send them to an area where they need care and assistance. And then if any head injury or deep cuts or lacerations or complicated comminuted fractures, posting them into the OTs or ICUs, and maintaining their status. Minor treatment areas are nothing but people who have just a small injury or a small cut and bleed, treating them in the minor treatment areas. Mortuary services, if people are dead, then as you have said, somebody has said right means before, like bagging and tagging. So triaging, we will do this tagging, and for people who are dead, we'll do this bagging, wherein we'll put them into black color or white color bags, and we'll put a tag, and then send the body to mortuary services. And whenever a disaster happens, there are so many processes that the hospital has to do before handing over the body to the relatives or family members. And then holding area for relatives and non-injured. So all the victims will be treated in the hospital, and their family members, whoever are there, should be given an area to sit. And also they are not allowed to step into the emergency departments where the care is being given to the victims. 10th one is phase of staff education and training. So phase of staff education and training is nothing but involving the staff uh, uh, in the disaster drills or mock drills. Tabletop drills. So tabletop drills are nothing but these are mainly for the hospital administrators and the managers, and this is a paperwork that is done regarding the plan of controlling the situation whenever a disaster outbreak is there. And then evacuation drills are nothing but saving people from the disaster area by not complicating situation or not making them land up into complications. Then partial evacuation is, now as I have given you an example, building collapse, or there is a fire accident that is happening. So partial evacuation is done, wherein we start evacuating people around, and then we start evacuating people from one corner to the other corner wherever the incident has happened. And there are two ways of doing partial evacuation, that is horizontal and vertical. So to explain you about horizontal evacuation is moving from the ward where the incident happened to the same floor ward. Understanding, horizontal is side to side, whereas vertical can be either to the top or to the bottom wherever the incident has happened. So accordingly, to the top or the bottom, or completely out of the building. Okay, so that is vertical. And full evacuation is completely making people come out of that particular area wherever the incident has happened. uh, that is full evacuation. So these were the 12 points that we have discussed under pre-disaster phase. So I hope it was clear. If you want me to repeat any pre-phase plan components, I'll repeat it. So I hope it was clear. So let's move on to the second phase, that is disaster phase. So disaster phase is the actual phase that happens when disaster really consumes the hospital resources. So the plan includes everything, wherein we don't know what will happen, but we are already ready if a situation comes in. So disaster phase is nothing but whenever there is an outbreak, it really consumes time, it really needs resources, it needs manpower to support people who are the victims of disaster. So in this phase, disaster activation, appointment of incident commander, incident staff, and disaster deactivation happens to deal with the situation. It includes disaster activation. So it's nothing but disaster phase includes the disaster committee and people from other departments to control the situation. And to deal with the situation, what all are included is disaster activation. First thing is alerting people about disaster. Second thing is manpower is needed so that services can be provided to the victims. Third one is incident commander. Incident commander plays a major role in helping people, in triaging people, in supporting the staff about making and taking decision. Incident staff. Incident staff is nothing but person who the staff who will take care or take the complete responsibility of categorizing people, providing care to the people, delegating the work to the subordinates, etc. And this incident staff includes operations chief, logistics chief, planning chief. So operations chief is nothing but seeing to it that how the work is happening, whether the disaster is under control or no. Second one is logistics chief. Logistics chief is completely keeping I mean, completely focusing on keeping ready of equipment, medical supplies, and if needed, uh, what you call blood transfusion, keeping a link or keeping an association with the people of blood bank. And also if medical supplies are running out, making sure that they avail it as early as possible before the casualties come into the hospital. And then the planning chief is nothing but if the situation is worsening, immediately making or taking decisions. Then the public relation officer, as I said, you public relation officer will transmit the information and describe about the situation to family members, relatives, as well as the media. The liaison officer make sure that the logistics are no in place or at accuracy in stock, and also making sure that the information is being transferred from the hospital management to the people of media, so that there is no barrier between transferring of communication. Then is the security and fire officer. The security and fire officer, in case of fire accidents or any kind of scope of developing building collapse or incident of or in breaking out of a fire. So it's very much important to alert the security and fire officer. And then the finance officer, so that no he can allot a budget, or he can make some possibilities of alerting people regarding what all equipments and supplies are needed during that situation to treat people. And then span of control in incident system. Span of control in incident system is keeping a check on people, keeping a check on the triaging system, and keeping the situation under control, because that situation, people people whoever are affected, no, will be in a state wherein there can errors happen. They can be, at a risk of developing complications or etc. So no, span of control in incident system is nothing but you, rather than complicating the situation, making sure that the whole scenario is falling in place. And then it's coming back to normalcy. And then different types of hospital responses. So what call the hospital should take, and what should be the plan of the medical team during the phase of disaster, that is in-house response phase. In-house response phase is nothing but in the hospital, making sure that you increase the bed strength, or increase the stock, increase the equipment, or assuring people that you can provide care, or making certain decisions in providing treatment. That is in-house response, which is happening within the hospital. Second one is additional area or out of hospital support phase. This is in the outside the hospital, means if you are running short of amenities, referring the patient to a better hospital wherever they can have proper amenities. And then the third one is damage to hospital phase. Damage to hospital phase is nothing but it's a hospital has certain limiting no, taking patients, admitting patients, providing care. But when a disaster happens, it is very much mandatory, because you cannot send the casualties back home or back to some other place. So the whole hospital system for that particular day, or whole hospital schedule gets changed for that particular day. And also there are chances wherein the people who are already admitted can lack of the uh, need based care whatever they need. So it completely damages to the hospital schedule and the hospital protocol, because immediately the situation had happened wherein the medical fraternity had to take call on changing and doing stuff. Then catastrophic disaster in city phase. So catastrophic disaster in city places, uh, a disaster uh, that will that happens wherein mass casualties are there, and these mass casualties cannot be treated in one particular hospital, wherein the hospital needs collaboration from the other organizations or other healthcare facilities, so that then only the victims can be safeguarded and they'll not land up into complications. Seventh one is disaster deactivation. So once all this happens and no people are triaged, people are provided treatment, or no if there is no amenities available to treat people, they are being shifted. If everything is happening, then it is also mandatory to let people know outside, like the society know about how did the disaster happen, or what happened during the disaster phase, and did it come to an end, or is there any scope of the incident to happen again and again, or is there any chance of complications that people will land up into. And then if everything is clear and people are coming out of that situation, then they'll alert, or they'll uh, let people know about the disaster deactivation plan, wherein the disaster deactivation states the situation has come to an end and everything is under control. So that were the seven more important most important components in the disaster phase. So again, I'm repeating the seven components. First one is the disaster activation. Second one is essential nursing and ancillary services activation. Incident commander, incident staff, who play an important role in segregating people, in seeing for the equipments, in planning care, in transferring communication from people from the hospital management to the people outside. And then the liaison officer, who has a collaboration with the medical fraternity as well as the other departments. And then security fire officer, finance officer, and how the incident system is maintaining that span of control. And then types of hospital responses, what call the hospital takes, which is categorized into what happens in the hospital, but what happens outside the hospital, and how the hospital is affected because of the disaster situation, and what is catastrophic disaster in city phase. And then is disaster deactivation. So disaster deactivation is once everything happens, the situation comes under control, then it is announced that everything is fine and under control, and people, these many people have survived, these many people are injured, and there is no further things that we are working into, that is done by the management of the hospital. Then post disaster phase, as I have said you again, I'm not going to, no, I'm not going to beat around the bush, I'm directly coming into the point. In a nutshell, if I have to tell you about what is post disaster phase, it is nothing but after the situation happens, the committee sits together and sees how the plan was implemented, what was the pros and cons, and what can be done, no, to do it in a better way in the future. Then comes the role of hospital administrator. So the role of hospital administrator is to prepare disaster plan using a phase plan consisting of all phases as discussed before, and then they also should have an emergency disaster plan for hospital. Hospital administrator is one of the important member of disaster management committee, and he or she will inform the incident command system, which will come into effect at the time of mass casualty and closes down on withdrawal of disaster alert. And then hospital administrator role is also crucial in assigning jobs to different person in the command system, because we cannot give responsibility to the people who don't have caliber. So it is very much important to know the caliber of the staff who can do their job properly without harming people or causing errors. Disaster deactivation is one of the important phase of hospital emergency plan, where hospital administrator along with incident commander takes decision after assessing the situation. So if the deactivation happens, then everything falls back to normalcy, and again the hospital starts functioning the same way it used to. If it is not deactivated, it means the situation is still, at the peaks, or there is chance of the situation to get worsen. So it is very much important to completely focus on the victims of disaster. So till the disaster deactivation plan is not implemented, nobody will take up any other new emergency cases, or no will plan for any surgeries, or everything will be postponed till this situation comes under control. So that was all about your fifth unit, that is hospital emergency plan principles and process. So to summarize this topic, I have started with introduction, disaster plan, the needs and objectives. Then we have discussed about principles of a hospital, and we have discussed about process of developing emergency disaster plan. And in that plan, we have three phases, that is pre disaster phase, and post disaster phase. And then we have also discussed about a role of hospital administrator. So I hope I was clear, and if you have any doubts, please do ask.
Ma'am, after a disaster, uh,
Yeah.
when the administration wants to clean up and start rebuilding the premises,
Mm.
do they have to wait for the insurance people to come and evaluate, or can they start the process, ma'am?
See, it depends on the level of disaster that has taken place. Okay, so for example, if a complete floor is damaged, then we can start off with our no system of providing care, and delivering services to people, wherein we don't cause any harm, or we are sure that uh, no no such thing again happens. But if we are not sure the whole building is collapsed, or the functions are interrupted, then we cannot wait till the hospital management takes the call. So it is completely in the hands of the management to take or make decisions. Until and unless there is no harm for the people, according to the protocol, we can start off with the regular job responsibilities what we have. But as I said you, it depends on the type of disaster that has taken place. For example, it is a building collapse, yes, we cannot do anything until and unless no the management takes the call. And then secondary thing is, if it is a fire accident or something, if we have much place to accommodate people and provide them better services, yes, we can go for it. Again, if we don't have, then because there is a chance of developing cross infection, because the area is not sterile already. The whole equipment is we have lost. There is so much economic loss and stuff that has happened. So nothing is in the hand of the staff or people. It is completely in the hands of the authority, whoever is
Administrator.
responsible. Yeah, whoever is responsible. Sometimes the administrators will also not have the right to do it, because it can be the organization that is a charitable organization, or that is run through trusts, or is attached to a society, or etc. So the committee will decide about what to be done.
Okay, there will be a committee to decide, make
Yes,
decisions.
say nurse, sorry, a hospital administrator is a person who holds a cadre in a hospital, right?
Yeah, yeah,
But
yeah.
he doesn't own the hospital.
Yes, yes.
So whoever is responsible, whoever owns it, has the right to make decisions. And he should also get legal approval that the disaster happened, and am I no supposed to continue my services. And they should also assure that they don't make people land up into another problem. So if they get that clearance, they can do that job.
They have to get the clearance before providing
That-
services.
yes, they have to get clearance, because that we don't know. No, so for example, your question is very much clear, that can we do it if a disaster happens, right? But
Yes.
what I am telling is type of disaster matters. If there is a building collapse, how will you be able to do it when you don't have a building, right?
Yeah. But when it comes to minor hiccups, like maybe a short circuit or a minor fire accident, then it
You
depends
can
on the
restrict people
administration's
going.
choice.
That is again the committee should sit together and do.
Okay.
Because if there is this electrical short circuit, and you have only 3 floors, wherein 2 floors have this problem, where there is no supply, electrical supply. So you can only run the OPD basis by giving the treatment rather than admitting people in the hospital. Understanding? So that you can support them. And nowadays, if you see, as the technological advancements have happened, we have this mobile nursing, home care, everything, right?
Yeah.
So than running into laws, the committee can decide till the things fall in place, or the reconstruction, or no putting the wiring again. So by the time, can we provide this home based care, or only OPD services where we can treat people, or
Okay.
create a unit or a ward separately to support the people who are walking into the our hospital, right?
Yes.
Okay.
Thank you, ma'am.
Yeah. Any other doubts? So if you don't have any, we can have it in the second session. Just let's take a 10 minutes break and get back.
Sure, ma'am.
Yep. Okay, let's get back to the next topic. So, is the PPT visible?
Not yet, ma'am.
No.
Now it is.
Okay. Yeah. Okay. So, let's end the subject today. So, this is your last unit, that is emergency manual for hospitals. So far we have discussed about what is hospital safety and how hospital administrators play a important role in planning a safe and secured environment for people. What are the techniques to prevent occupational hazards that we have seen in one unit, and then we have also discussed about fire safety. We have discussed about what is disaster and how we plan the disaster emergency plan. Okay, so this is our last unit over here, and that is unit 6, emergency manual for hospitals. So very clearly I'm telling you, I'll give you a very brief information, and whenever you get time, then please uh, open your textbooks and look into it, wherein they have given a clear description and way more explanation about briefing the answers. Okay, and they have also given a flow chart which I have not put into the PPT because it is very much self-explanatory, and I'll tell you about how the flow chart no, is connected to one another. So let's start off with this unit, that is emergency manual for hospitals. So starting off with the introduction, emergency manual or disaster manual is a written document of the hospital emergency plan, and the manual includes different activities of disaster management, right from reporting, recording, coordinating to evaluation of the activities. The emergency manual is designed by the hospital in accordance with the manpower and infrastructure resources to meet the unforeseen challenges faced during a disaster. So completely, an emergency manual is nothing but it helps in prediction, and it also helps in forecasting what to be done whenever a disaster happens, and it has a clear description about how things will fall in place, how the recording process, the reporting process should be done, and how every whole medical fraternity comes together, collaborates in performing the activities during a disaster. So blueprint of the emergency or disaster manual. So what does an emergency manual consists of? It gives a detailed description of the hospital's processes and requirements that are required for managing a disaster situation. So the emergency manual has a clear description about what are the hospital norms, what are the hospital protocols, what are the hospital requirements, and how the hospital will manage a disaster situation. So an emergency blueprint will give foundation for successful implementation of the disaster manual by mapping out the requirements of a disaster plan and how intense it should operate. It includes the following things, that are unified incident command, location of the control center, names, contact number, and positions of all the staff included in the incident command structure. So basically, this blueprint consists of a whole description about how the disaster plan will be activated, how people will come to the incident area to rescue and evacuate people, and then what all departments will collab together in safeguarding people, and also there will be a name list of people who are the team, the emergency disaster management team. Okay, and then a list of all the disaster alert codes. So all the hospitals have different codes which we will discuss further. So all the alert codes should be listed out, and every unit should have this alert codes, and it will be very much beneficial even at the nook and corners of every floor if they paste or have a display of this disaster alert codes. Details of the teams that should be formed during a disaster, the responsibility and movement details, list of responsibilities of individuals and departments, um, and job action cards, chronological action plan, a detailed information on resource mobilization for logistics and manpower planning during a disaster, complete information on complete information on all the operational areas, list of all protocols and standing orders of patient management. So again, I'll list it down. So generally, a blueprint will have the whole description about the hospital. It will have about the committee and the departments that are included, and also it will have the initiative of different departments that will come together in providing care during the disaster. And also they'll have a name, they should have a name list and contact numbers of people who are in the disaster control committee. And all disaster alert codes should be placed in all the units as well as over in the whole hospital. And then according to the the ability, the job authorities to be delegated to people. And every individual and every department should take initiative whenever a disaster outbreaks happen. Job action cards is nothing but code, knowing about the codes, knowing about the alarms, and also knowing about what responsibility is theirs whenever a disaster outbreak is there. Chronological action plan is nothing but maintaining a hierarchy, of approaching people, and doing I mean implementing the plan according to the protocol of the hospital. And then a detailed information on resource mobilization for logistics and manpower planning during a disaster, means making sure that the equipment is ready prior hand, making sure that you have all the facilities that will help in transferring patient in and out, and also you have adequate manpower to support the victims of disaster. Complete information on all the operational areas. That is nothing but all the units, all the functioning units should be ready to take charges. List of all the protocols and standing orders for patient management. And uh, the whole hospital should be ready in receiving the casualties, and also they should provide need based care based on the protocol of the hospital, because they don't have any right to do anything on their own. Everything should go according to the norms, rules and regulations and priorities of hospital. Next one is a clear description on the criteria of hospital triage. So the triage system should be followed, wherein categorizing the casualties from mild, moderate, severe. And then details on documentation. So whoever walks in, a proper history to be collected and proper documentation of the procedure to be done. And intra and inter hospital communication, that is nothing but within the hospital communication and hospital to hospital communication, if you are referring a patient from your hospital to another hospital for providing better care. Then hospital networking based on the resources and capabilities of the hospital facilities. So hospital networking is nothing but similar to intra and inter hospital communications, wherein within the units they should have a proper communication of shifting patient from one unit to the other unit, sending patients for CT scans or operation theaters. No, that comes under intra inter hospital, wherein hospital networking is referral, connection within hospital to hospital. If our hospital doesn't have, I make sure that I send the patient to a better hospital wherein all his needs can be fulfilled, rather than making that particular person lose his life. And then hospital transport facilities, that is nothing but from the disaster area, the ambulatory services to the hospital, if from the hospital to another hospital. So making sure about the transport facilities, security arrangements, because there will be rush, there will be crowd, there will be coming in of people, coming in of third parties, coming in of people who don't even belong to that particular area. So it's very much important to alert the security, and to also make sure that things uh, doesn't fall out of control. And then network with police department is nothing but there will be certain cases which need a which will be a medical legal case, or which needs an what you call approval from police department in case of deaths. So before handing over it to the family or relatives, or if people you know, don't have anybody uh, who are related to the victims, then the police department will help in doing the formalities. And then details on evacuation plan. So details on evacuation plan is from the area where the disaster has happened, evacuating people safely and getting them to the medical facilities, so that they have a secured and a safe environment to survive. And then medico-legal responsibilities during a disaster. As I said, the police department has a greater collaboration with the Department of Medicine, because at a point there will be need of this department to come in and help the medical facilities. Uh, and they will take up certain responsibilities and make our work easier. And then a detailed description on how to dispose dead bodies, which include service of mortuary department and forensic department in identification, storage, and disposal of the dead. So, in case if there is a building collapse wherein a person has lost his life, and there was so much crush injury in his body, wherein the face got crushed, or the person was completely chopped off, then the forensic department also comes into force, wherein in identifying the patient and about how to store his or her dead body, and then what will be the final disposal. So many of the departments come together, and they help in sorting out the problems. Next is emergency codes of hospital. So every hospital has emergency codes, and it is very much important to alert staff on various emergencies, as well as to alert people and make sure that people are evacuated and are safe. The main purpose of emergency codes is to convey important information to the staff quickly and with minimal understanding, at the same time preventing panic and stress among patients and visitors. These codes are placed on placards or posted on employee badges for easy reference. An emergency code is basically a notification of an event that needs immediate attention. So it's self-explanatory, so I'm not going to explain it. And then benefits of emergency codes. So what are the benefits? The basic purpose of emergency codes is to alert the hospital employees about an emergency without causing any panic among the patients or visitors. So these codes are completely for the staff who is in the hospital. The no Because if they are aware, they can control the situation rather than creating stress and panic among visitors or patients in the hospital. Information received through emergency code requires no further explanation. Once the code is activated, it means people are in need of an emergency, and people are in an emergency situation and are in need of assistance. So any code which is activated, the committees should the emergency no committee should rush in. The hospital administrators and the management should rush in. They don't need to wait for furthermore explanation. Based on the nature of emergency code, staff can understand what type of action is required, and it gives information that can be easily understood by the employees and helps them teach to reach the designated place quickly. So whenever a code is activated, so proper description is also given about the code, so that people who are in the emergency department or the committee, the administrators, and the disaster committee people can rush to the area in supporting and assisting them. So the codes can be facility alert, medical alert, or security alert codes. Examples of facility alert codes include evacuation, fire alarm, flood, and hazardous spill. Medical codes include mass casualty incidents, cardiac arrest, etc. And security alert codes include missing person, bomb threat, and active shooter, etc. So which is very much self-explanatory again. So I have given a few examples about what are facility alerts, what are medical codes during which are used during mass casualties, and certain security alerts, so that assistance is provided and the situation is controlled. Okay. And next one is, so these are the different codes that are used in hospital. If you see, please pay attention. I'll give you the example then and there. I'm not going to explain you in detail about these codes. Everything is very much self-understanding. Please, whenever you get time, open your books and go through every code. So I'll give you just a brief information about it. So first code is code blue. So code blue is for cardiac arrest. So whenever a patient has and cardiac arrest, or is gasping for air, means doesn't have proper, means has difficulty in breathing in and breathing out, then this code is activated, wherein the staff is not able to control the situation or support the client by medication or something. And the code blue is especially for starting resuscitation for the patient. As you will all know about what is resuscitation. Resuscitation is nothing but initiating CPR for the patient who is in need, and making him to survive again. So whenever a cardiac arrest happens, the staff in the hospital will activate code blue. Second comes code red, which we have already discussed. Code red is fire in the hospital. So fire in the hospital, activation of code red, activating people. And when we talk about code red, two things should come into your mind. So in the previous class also, I have discussed about two acronyms. So the first acronym was race and the second acronym was pass, if you remember. Can anybody expand what is race and what is pass?
Ma'am, how to pull a
Rescue,
fire
alarm,
extinguisher
Yes,
is pass.
race means
How to
rescue, alarm,
rescue? Yeah,
rescue, alarm.
alarm,
Yes.
alarm.
C. Sorry, S. RES. RESS. Sorry, RAC. RAC. R is rescue, A is alarm,
says,
C is confine, and
I see.
E is
Extinguish or evacuate.
Evaluate,
evacuate. Yes,
evaluate,
evacuate.
extinguish, ma'am, extinguish,
Yes. Then what is pass? PASS.
pull,
Pull,
beam, pull,
aim, pull, aim,
aim,
and S. Two S are there. Pull, aim, and squeeze, sweep. Okay, so
Yes.
these are the
Yeah.
two things that you have to keep in your mind whenever there is code red. So activation of the code red, trying to rescue people, trying to alarming and alerting people, and confining the area, then spreading the fire, and then also evacuating people. At the same time, if the nurse has a good knowledge about using an fire extinguisher, then, and she has attended the mock drills, or she was a part in the disaster drill, then she can immediately take the extinguisher and start pulling it, aiming at the fire, squeezing it, and sweeping so that the fire is under control. That is about code red. And then moving on to code black. Code black is nothing but bomb threat and internal disaster. And an example that I can give you for code black is number of questions you have to ask whenever there is code black, especially if there is a bomb threat wherein you receive a call that a bomb has been placed in the organization, means in the hospital. So first thing you have to make sure is asking questions. So when you somebody's audio is on, can you please put up the audio? Yeah, thank you. So whenever there is a bomb threat, means if a staff receives a call about that a bomb has been placed in the hospital, then first thing the staff has to do is not to panic or not to keep the phone and run out of the building. The first thing what she has to do is she has to ask who you are, from where you're talking, where did you see no where did you see the bomb, what is the time that has been displayed, how many people are there around, and then uh, uh, no what you call okay what is why are you calling me, and from where you're calling me, where do you belong to. And also she has to have the assumption whether what will be means the gender, whether it's a female or a male, or and also she should ask for the background. Why did you call me? Are there anybody security or anybody there? Why didn't you approach them and you are calling me? Certain things she can do. And also she should also make sure that what will be the age of that particular person who is calling, or it is a threatening call, or a fake call. No, everything she has to assume when it comes to code black. Okay, so that is about code black. Then moving on to code pink. Code pink is child abduction or kidnapping, especially children from 0 to 15 years, where whenever a child goes missing, so this code is activated, and it is very much important that to find the child as early as possible. Then code brown. Code brown is any chemical spill which is very much hazardous and which can cause problems for people around. And code white. Code white
Ma'am,
is
I
why.
have one doubt, ma'am.
Yes.
This is code black means bomb threat, and internal disaster means what? Which disasters we can consider as a internal, ma'am? This code black. So
So
internal disasters
okay.
means
So internal disaster can be a rivalry wherein people who don't have good terms with the management, right? So they try to threaten the management. Understanding. So for example, they are very much stressed or they are not getting paid, they call and they say that we will come, we will politically do this, that. Understanding, that is internal disaster which happens within the team or within the organization for causing an economic loss or for making the hospital uh, or causing a negative impact on a hospital. So internal is within the institution, between the colleagues or no, between the patient and the management. So this
if
is internal
if
disaster.
patients or
Understand?
attenders, if in cases they will
Yes,
spoil the
they will
hospitals, no, ma'am.
they will threaten the physicians, they will threaten the management that because of you I lost my no husband or
Patient.
I lost my wife, and then they'll tell that I'll come, I'll no what you call I'll see to it that you people don't work or seize the hospital. All such kind of things will come under this code line.
Yeah,
Understand?
ma'am. Yes, ma'am. We
Okay.
understood, ma'am.
Yes. Then moving on to code white. Code white is violent persons again. So during the mass casualties during disaster, no, people are not allowed to come in because it is an emergency situation. Only the victims who are affected are taken into the hospital, wherein the family members, the relatives, and other third parties are restricted. But certain people start making nuisance in the hospital, so the security should come in and see to it that they don't hurt anybody or create more violence in the area. And then code purple. Code purple is physical assault. Whenever there is assault on staff, the management or physician, code purple is activated. Next, moving on to code yellow. Code yellow is missing patient. So missing can be any kind. So it can be llama or anything. So brief history to be taken, and if CC surveillance is there in the hospital, then it is well and good to make the clear or make a clear note or announcement about how the patient is missing. Then code silver is person with a weapon or active shooter. So people who carry weapons or people who want to harm others, then we have to activate code silver. Then moving on to code gray. Code gray is infrastructure loss or failure. So for example, no, falling off roof or falling off fixed machinery, or leaking of the smoke, so certain kind of things comes under. So if certain kind of things happen, then code gray is activated. Then code green. Code green is internal evacuation due to for example, uh, okay, the best example I can give you is any spillage of chemicals or spillage or sorry leakage of gases that are hazardous, then code green is activated. And also it can be due to leakage of any chemical materials. Okay. And then code orange is disaster in the community. So in the locality or inside the hospital or around, means the surroundings of the hospital, then code orange is activated. As well as whenever there is an epidemic or endemic or pandemic, code orange is activated based on the uh, uh, rate of people who are affected. Understanding? So these are the codes. Again, I'm repeating. So there are totally 12 codes. So the codes are blue, red, black, pink, brown, white, purple, yellow, silver, green, and green and orange. So I hope the codes are clear. So let's move on to the continuation of it. In case of emergency, code shall be announced thrice over the public addressing system and shall be reported every 30 seconds for 2 minutes. So whenever a code is activated, it should be announced thrice. For example, code red. So code red three times over the telephone or in the ward, wherever it is. So three times the person has to announce it, and they have to repeat it for 2 minutes every 30 seconds. And then mock drills are also one of the important aspects of emergency planning. And every 6 months, all the employees in all the shifts, especially those working in emergency ICUs, OT, dialysis, should undergo mock drills. So people in the emergency departments will not have time because they work for like many hours, or they don't have a particular timing when they find time to rest, or they find time to take a break. So it is very much mandatory that 6 months once at least we involve them in this mock drill sessions. Okay. And then that was about the codes in hospital. Next is hospital levels of hospitals and model emergency disaster plan. So healthcare can be categorized as primary, secondary, and tertiary depending on the complexity of medical cases they treat and the skills and specifications they provide. So everywhere in the medical department, any scenario we categorize into it into three things, that is primary, secondary, and tertiary. So primary is nothing but beforehand we make sure that the situation is not worse. Secondary is in the situation but not making them develop complication. Tertiary is already the situation is complicated but we don't allow them to die, rather we give them a better support to lead a sustainable life. Okay. So here there are some specifications. They are emergency plan for a community health center. So whenever a disaster happens, so immediately seeing to it that we shift them to the nearby localities, and also we alert all the community health centers and the community health centers especially to stabilize people. And in case if the community health center is running short of amenities, they can refer them to multi-speciality or super speciality hospitals. And then hospital emergency plan preparation, as we have discussed in the previous unit also, before a disaster happens, all the hospitals should have a manual and emergency plan beforehand. And out of hospital plan, that is going to the area where the disaster has happened and providing care. In-house emergency is internally inside the hospital. Then comes all the three phases, that is pre-disaster, disaster, and post-disaster phase. So I'm not going to explain you in detail because everything is similar which we have discussed in the previous unit. I'll just sort out a few things that are very much important to concentrate in the three phases. That is, in the pre-disaster phase, first thing is the committee should take a lead. There should be a control room which should start up with the plan and support the staff and the medical fraternity in carrying out the activities. And then organizing patient treatment areas, especially desk to check the vitals and to triage them, and patient resuscitation area if people are losing life, people have a cardiac arrest, or the pulse is not found, then immediately CPR to be started. Patient orientation area, because of that disaster people will be in shock, so making people stabilize, giving them proper position, comfortable place, helping them to relax and orienting them to what happened, how it happened, and making sure that they stabilize. Minor treatment area for people who have very minor injuries, and shifting people to operation theaters if they have fractures or injury. And then organization of wards is nothing but, as the disaster has taken place, we need place for the casualties in the hospital. So no or what you call, making place or making extra units for people to come and get their treatment, organization of mortuary, organization of patient transfer, medical and nursing services. Again, the referral system over here, if we are not able to provide services, transferring them to a better amenities hospital. And then organization of logistics, medical supply, security and public relations. And then comes the disaster phase, whatever happens during the disaster, how it happens, how we control it, how we safeguard, and deactivation of the disaster phase. And then comes the post disaster phase, wherein we try and we sit to find out what were the flaws, what were the pros and cons, what were the weakness of no, the medical staff in providing or rendering services to the victims of disaster. Next one is emergency plan for a teaching hospital. So the government as well as private medical colleges in India, with a bed strength of ranging 1000 to 1500. The average staff in teaching hospital are 1500 to 2000, and the teaching hospitals have all the specialty facilities and form the backbone of providing specialized care to the victims. So if we see, nowadays all the medical no all the medical colleges have a teaching hospital, and all the hospitals are connected with different organization, wherein uh, we don't lack in any kind of stock like medical supplies or what do you call any no, basic needs of patient. But it is very much important to provide qualitative care to the patient and to have a manpower that can support people. So though we have sufficient amount of staff, but we are not able to meet the qualitative care needs of patient, which is very much important. So as the description given over here, though the bed strength is 1000 to 1500 and the manpower is 1500 to 2000, but still there are few lacunae that are not filling the gap and not making people get a proper and qualitative care. And teaching hospitals have all the specialty facilities which help them in providing best and ultimate care. Hospital emergency plan is activated when they receive 50 to 60 patients. So whenever there is an emergency plan that is activated, then 50 to 60 patients, if there is arrival of 50 to 60 patients, then no, the schedule is completely changed before the casualties come in. And also the patients who are in need of care 24 bar 7 are given handover to certain staff, and the other staff work on the people who are going to enter into the casualties. And then again here also in the teaching hospital, we have this phases which is pre disaster and post disaster phases. The same thing applies here, having a plan, doing it, and finding out the lacunae so that in future we don't do the same problems. And so uh, again the same thing whatever I have taught you over here, that was like levels of hospital and model emergency disaster plan, wherein they have a committee, they have emergency plan, they have a plan inside the hospital and while transferring the patient. The same thing applies in emergency plan for university too. So there is no major difference between it. And a small assignment kind of thing, you think that is if you open your textbooks and see later, there is a flow chart given, wherein there is a hierarchy given of approaching people whenever there is a disaster. So in that they have mentioned about who activates the plan, means who makes the plan, who supports the staff, and how the codes are activated, and the disaster situation is controlled by taking initiation. So this was all about your sixth unit, that is emergency manual for hospitals. So I hope it was clear, and I'll summarize this unit again for you. So we have discussed about the introduction, we have discussed about what is the manual that is formulated in a hospital, and then we have discussed about what are the emergency codes that are used in the hospital, what are the benefits of emergency codes, and what are the different codes in hospital, and how the manual or the plan is maintained in the hospital as well as in the universities or teaching hospital. So this was all about your sixth unit. I hope I was clear, and if you have any doubts, you can ask me. So are you all clear, or you
Yes,
want
ma'am.
me
It
to
was quite
explain?
clear, ma'am.
So with this, we we come to an end, and the whole unit or the whole subject that hospital risk and disaster management is finished. So this is all about your hospital risk and disaster management. So all six units I have covered. So if you have any doubts, you can get back to me. You can just approach Sukumar sir and he'll let me know so that I can get back to you all. So I hope I was clear, and we'll end the session for today.
Thank you, ma'am.
Thank you and have a good day.
Thank you, ma'am.
Yeah, thank you, ma'am, for a valuable time.
Thank you, Sukumar sir.
Dear students, in this third semester, successfully hospital risk and disaster management subject completed. Okay, ma'am, you can leave. I will take attendance for this.
Okay, okay. Thank you.
Thank you, ma'am.